The American healthcare system is in desperate need of reform. We're facing skyrocketing costs and limited access, leaving many without the care they need. Imagine a system where affordable coverage is a reality for everyone, where prescription medication prices are brought down to earth, and where preventative care is prioritized. Investment in healthcare technology can streamline services and improve patient outcomes. We also need to tackle the shortage of healthcare workers and ensure they are compensated fairly for their vital work. It's time for legislators, medical experts, and the public to unite and innovate. Together, we can create a healthcare system that is not only efficient, but truly equitable for all Americans. Let's envision a healthier future where quality care is accessible to everyone.
The United States spends more on healthcare than any other developed nation. Yet, millions of Americans struggle to afford basic medical care. This disparity highlights a stark reality. Our healthcare system is in dire need of reform. For too long, we have grappled with escalating costs, limited access, and persistent health disparities. The COVID-19 pandemic further exposed the fragility of our system, pushing it to its breaking point. The need for comprehensive reform is undeniable and urgent. The current state of healthcare in America is a source of anxiety for many. Families grapple with soaring insurance premiums and exorbitant medical bills. Many are forced to make difficult choices between their health and their financial well-being. This is simply unacceptable. We need solutions that prioritize the health and well-being of all Americans. The challenges facing our healthcare system are complex and multifaceted. There are no easy fixes. However, the status quo is unsustainable. We need bold leadership and innovative solutions to address this pressing issue. The time for action is now. The financial burden of healthcare weighs heavily on individuals, families, and the overall economy. Americans face skyrocketing costs for prescription drugs, hospital stays, and even routine doctor visits. Deductibles and copays have become increasingly burdensome, making it difficult for many to afford the care they need. This financial strain often leads to delayed or foregone care, resulting in poorer health outcomes and increased healthcare costs in the long run. Access to quality healthcare remains a significant challenge, particularly for low-income communities, rural populations, and communities of color. Geographic disparities in healthcare provider distribution leave many underserved areas with limited options for care. Furthermore, systemic barriers, such as insurance coverage gaps and language barriers, exacerbate these disparities, creating a cycle of health inequity. The shortage of healthcare workers, particularly in primary care and specialized fields, further compounds these challenges. This shortage strains the existing workforce, leading to longer wait times for appointments and increased workloads for providers. Addressing this workforce crisis is crucial to ensuring timely access to quality care for all Americans. In a move that sent shockwaves through the nation, President Biden nominated Robert F. Kennedy Jr. to lead the Department of Health and Human Services. Kennedy, a prominent environmental activist and lawyer, is a controversial figure known for his outspoken views on vaccines, processed food, and the pharmaceutical industry. His nomination has ignited a firestorm of debate, with supporters praising his commitment to public health and critics expressing deep concern over his unconventional stances on key health issues. Kennedy's nomination comes at a pivotal moment for American healthcare. The nation is grappling with the ongoing COVID-19 pandemic, soaring healthcare costs, and a deepening crisis of trust in public health institutions. His supporters argue that he is a fearless advocate for the people, willing to challenge the status quo and take on powerful interests. They believe his passion and commitment to public health make him the right person to lead the charge for reform. However, Kennedy's nomination has also been met with widespread criticism and apprehension. His long-standing skepticism of vaccines, particularly his assertion that vaccines can cause autism, has alarmed many health experts and public health officials. Critics argue that his views on vaccines are not supported by scientific evidence and could undermine decades of progress in vaccination rates and disease prevention. Robert F. Kennedy Jr. is a complex and enigmatic figure who has dedicated his life to advocating for environmental protection and public health. He is a scion of one of America's most prominent political families, the son of Robert F. Kennedy and nephew of former President John F. Kennedy. His family legacy is intertwined with both triumph and tragedy, shaping his worldview and fueling his passion for social justice. Kennedy's environmental activism has earned him accolades and recognition. He has been a vocal critic of pollution and environmental degradation, fighting tirelessly to protect clean water and air. His work has often put him at odds with powerful corporations and government agencies. However, his views on vaccines and other public health issues have made him a polarizing figure. He has been a leading voice in the anti-vaccine movement, promoting the debunked claim that vaccines cause autism. His stance has drawn sharp condemnation from the medical community and public health experts who warn that his rhetoric could have dangerous consequences. Despite the controversy, Kennedy remains steadfast in his beliefs. He sees himself as a defender of individual rights and a champion of the voiceless. His nomination to lead the Department of Health and Human Services is a testament to his unwavering commitment to public health, even as his views continue to spark debate and division. Section 5. A Nation Divided Reactions to the Nomination. The announcement of Robert F. Kennedy Jr.'s nomination sent shockwaves through the political establishment and ignited a firestorm of debate across the nation. Supporters and detractors alike took to the airwaves and social media to voice their opinions, highlighting the deep divisions that Kennedy's nomination has exposed. On one side of the aisle, progressive Democrats and environmental groups lauded the nomination, praising Kennedy's long-standing commitment to public health and environmental justice. They pointed to his track record of challenging corporate power and advocating for the voiceless as evidence of his dedication to the common good. His supporters view him as a much-needed disruptor, someone who will shake up the status quo and fight for the health and well-being of all Americans. However, Kennedy's nomination was met with swift and fierce opposition from the medical community, public health experts, and many moderate Democrats. They expressed grave concerns about his views on vaccines and his potential to undermine decades of progress in public health. Critics fear that his appointment could erode public trust in vaccines and scientific evidence, potentially leading to outbreaks of preventable diseases. Section 6. Reimagining Healthcare, Kennedy's Proposed Policies. Robert F. Kennedy Jr. has outlined a sweeping vision for reforming the American healthcare system, one that emphasizes preventative care, empowers consumers, and challenges the influence of pharmaceutical companies. His proposals have generated both excitement and apprehension, reflecting the complex and often contentious debate surrounding healthcare reform in the United States. One of Kennedy's signature proposals is to expand access to preventative care and wellness programs. He argues that shifting the focus from treating illness to preventing it in the first place is essential to improving health outcomes and reducing healthcare costs. Kennedy believes that empowering individuals to take control of their health through lifestyle changes, early detection, and disease prevention is key to creating a healthier society. Kennedy is also a vocal critic of the pharmaceutical industry, which he accuses of prioritizing profits over people. He has pledged to lower prescription drug costs by allowing Medicare to negotiate drug prices, increasing competition among drug manufacturers, and cracking down on what he sees as unfair pricing practices. Kennedy believes that making prescription drugs more affordable is crucial to ensuring that all Americans have access to the medications they need. Section 7. The Vaccine Debate, a Point of Contention. Robert F. Kennedy Jr.'s stance on vaccines has emerged as a major flashpoint in the debate surrounding his nomination to lead the Department of Health and Human Services. Kennedy's long-standing skepticism of vaccines, particularly his assertion that vaccines can cause autism, has drawn sharp condemnation from the medical community, public health experts, and even members of his own family. Kennedy's views on vaccines are rooted in his belief that certain vaccines, particularly the MMR vaccine, can cause autism in children. He has been a vocal proponent of this theory for many years, despite the overwhelming scientific consensus that there is no link between vaccines and autism. The theory has been repeatedly debunked by numerous studies and medical organizations, including the Centers for Disease Control and Prevention, CDC, and the World Health Organization, WHO. Critics argue that Kennedy's views on vaccines are not only scientifically inaccurate but also dangerous. They fear that his platform and influence could erode public trust in vaccines, leading to a decline in vaccination rates and a resurgence of preventable diseases. They point to the recent measles outbreaks in the United States and other parts of the world as evidence of the real-world consequences of vaccine hesitancy. Section 8. Weighing the risks and benefits. Robert F. Kennedy Jr.'s nomination to lead the Department of Health and Human Services presents a complex dilemma. Kennedy's passion for public health and environmental justice makes him appealing, but his controversial views on vaccines raise concerns. Supporters see him as a visionary, while critics fear he could undermine public trust in vaccines. The risks and benefits of Kennedy's nomination are difficult to quantify. Section 9. The road ahead. Is Kennedy the answer? The debate over Robert F. Kennedy Jr.'s nomination to lead the Department of Health and Human Services reflects the deep divisions and anxieties surrounding healthcare in America today. Kennedy's nomination has become a lightning rod for a wide range of issues, from the role of science and evidence in policymaking to the influence of corporate interests in healthcare. As Kennedy's nomination heads to the Senate for confirmation, the nation is left to grapple with a fundamental question: is he the right person to lead American healthcare into the future? His supporters believe he is the transformative leader the nation needs, someone who will fight for the health and well-being of all Americans. His critics fear that his appointment would be a disaster for public health, potentially undermining decades of progress in disease prevention and health promotion. The stakes are high, and the outcome of this nomination will have far-reaching consequences for the health and well-being of the nation. Only time will tell whether Kennedy's vision for healthcare will come to fruition, or whether his tenure will be marked by controversy and division.
The American healthcare system is in dire need of reform, with skyrocketing costs and limited access leaving many without the care they need. To create a healthier future, it is time for legislators, medical experts, and the public to unite and innovate. Robert F. Kennedy Jr., 71, is among President Donald Trump's divisive cabinet picks, in part because he rose to prominence by expressing views that his critics deride as conspiracy theories. Kennedy is set to testify in Senate hearings Wednesday and Thursday, but just one of those committees will vote on his nomination to determine if his nomination goes before the full Senate for a vote. Among his views that have been discredited are Wi-Fi causes cancer, fluoride in public water systems causes bone cancer and IQ loss, and COVID-19 was ethnically targeted to attack Caucasians and Black people, while sparing Ashkenazi Jews and Chinese people. Kennedy gained a following with his Make America Healthy Again campaign, which focused on chronic diseases, additives in processed food, chemicals in the environment, and pharmaceutical drugs. Trump has also said he'd let Kennedy go wild on health, food, and medicine. Democratic senators have called for pushback, alarmed by the prospect of Kennedy's candidacy. Senator Elizabeth Warren, D-Mass, wrote Kennedy a letter before his confirmation hearings, saying, "I am deeply concerned that you could influence the vaccine approval and recommendation process by putting vaccine skeptics on advisory committees and make life-saving vaccines less accessible to American families." The Committee to Protect Healthcare released an open letter signed by more than 15,000 doctors urging the Senate to reject Kennedy's nomination. Caroline Kennedy, the daughter of former President John F. Kennedy and Kennedy's cousin, called him a predator in a letter she sent to senators ahead of the hearings. She said overseeing the Food and Drug Administration, National Institutes of Health, and the Centers for Diseases Control and Prevention, which are run by the Department of Health and Human Services, protect the most vulnerable amongst us, and constitute an enormous responsibility, and one that Bobby is unqualified to fill. Republicans have a 53-47 majority in the Senate, and a couple of GOP members told USA Today they were not worried about Kennedy's chances of being confirmed. Senator Cynthia Lummis, RYO, said she was very much in favor of his nomination. She thinks he'll concentrate on childhood obesity, which is a huge issue for our country. An outspoken critic of popular anti-obesity drugs, Kennedy seems to have tempered his views on the topic. Senator Bernie Moreno, R. Ohio, said he was not worried about Kennedy's stances or his prospects of confirmation. He said he was not worried about Kennedy's stances, including those on vaccines, because he said the nominees understand their job is to serve the president's agenda, not their own personal agenda. If they go outside Trump's agenda, they're going to get fired.